I would like to make you aware of an investigation NHS England has been undertaking, along with Public Health England, to investigate apparent breaches of infection control procedures by Nottinghamshire dentist Mr Desmond de Mello. Mr de Mello was contracted to provide NHS dental services at the former Daybrook dental practice, which is located at 88 Mansfield Road in the Gedling area of Nottinghamshire. In June this year, we at NHS England were contacted by a whistleblower at the practice who had concerns about the standards of clinical care being provided to dental patients. The whistleblower provided us with evidence to support these claims, including covertly filmed footage of Mr de Mello. This footage was filmed over a 3-day period during early June this year. The film appears to show multiple failures in cross-infection control standards whilst patients were undergoing dental treatment. In simple terms, this means acceptable hygiene standards did not appear to be followed by Mr de Mello whilst he was treating dental patients. Having reviewed the evidence, NHS England took immediate action and ordered an interim suspension of Mr de Mello from treating any further NHS patients. It was important for us to act quickly to protect patients from any further potential risk. We then commenced an investigation into clinical practices at the dental surgery and what the implications of this might be for patients. This investigation is ongoing and no findings have been made at this time in respect to Mr de Mello. As part of this process, we consulted with experts in Public Health England who undertook a clinical analysis of the possible risk to patients. Public Health England advised us that patients seen by Mr de Mello may have been placed at a low risk of infection from the blood-borne viruses hepatitis B, hepatitis C and HIV. In addition, none of us could be assured that these apparent lapses in practice were only limited to the days on which the covert filming was taken. For this reason, we have recommended that any patient who has ever received dental treatment from Mr de Mello be called back for screening. This will involve a discussion with a clinician and may also require a blood test to be undertaken. We estimate about 22,000 patients may be affected by this. Since this recommendation, NHS England has been working with partners to make the necessary arrangements for this patient recall. As Mr de Mello has been a dentist at this practice for over 32 years, the age of some of the patient records means it is not possible for us to write to everyone individually advising them of our recommendation. We are therefore making a public appeal through the media to recommend that, as a precautionary measure, all patients who may have received dental treatment from Mr de Mello seek further advice on what actions they need to take. A dedicated advice line has been established and the number is displayed at the bottom of this film. Patients can call this number to seek guidance on what to do next and how to access additional support. We have also set up a community clinic for patients to provide further advice, counselling and, where necessary, blood testing. This clinic is at Arnold Health Centre, which is located at Highcroft Medical Centre on the High Street in Arnold, Nottingham. Anyone who lives outside the area or is housebound and cannot get to the community clinic should contact the advice line for further information on how to access screening. We are extremely sorry for the undoubted worry and concern people may feel on hearing this news. I would like to stress again that the potential risk is low, but would encourage anyone who has been treated by Mr de Mello to contact the advice line or present themselves at the community clinic in Arnold, where clinicians are on hand to provide expert health advice. Effective treatments are available for these blood-borne viruses, which is why it is important to identify anyone who may have been placed at risk of possible infection, however low this may be, so treatment can be started if necessary. We are working closely with Public Health England to resolve this issue as quickly as possible and provide support and assistance to those who may be affected. We have written separately to the 166 patients who were filmed without consent to explain what has happened and offer assurances about the video footage which remains securely stored while this investigation is running. We will not disclose the identity of the whistleblower, as this person remains protected in law. We continue to offer support to this individual and thank them for bringing these matters to the attention of us all. On the 21st of August, the Interim Orders Committee of the General Dental Council, the national UK body which regulates dental professionals, suspended Mr de Mello for a period of 18 months whilst they undertake their own investigation into the concerns raised. Since August 2014, the former Daybrook dental practice has been under new ownership by Southern Dental, which is not in any way connected to this incident, but has offered ongoing support and cooperation to our investigation. Further patient information about this recall is also available on the NHS England website. I would again urge anyone who has been treated by Mr de Mello to contact the advice line or visit the community clinic at Arnold Health Centre. Thank you for viewing this short film.